Welcome to UMCC Medical Consultants Connectors, where your health matters to us. Ever wondered what acute myeloid leukemia is and how it affects the human body? This is a type of cancer that hits hard at the very life source within us, our blood and bone marrow. Characterized by a sudden surge in abnormal white blood cells, it disrupts the normal functioning of our body's defense system. This rapid increase in abnormal cells isn't just a random occurrence. It has specific triggers. So what causes this rapid increase in abnormal cells? Let's delve deeper. Acute myeloid leukemia is not caused by one single factor, but rather a combination of several. It's a complex disease with a variety of contributing elements. Genetic mutations play a significant role in its development. These changes in DNA affect the normal functioning of cells, leading to uncontrolled growth and division, which is a hallmark of all cancers. Certain blood disorders, such as myelodysplastic syndromes, can also predispose individuals to AML. These disorders cause abnormalities in blood cells, setting the stage for leukemia. Exposure to radiation and certain chemicals is another factor. Survivors of nuclear accidents or individuals exposed to chemicals like benzene, used in the rubber industry, are at a higher risk. And let's not forget about smoking. It's not just lung cancer that smokers need to worry about. The toxins in cigarettes can also lead to AML. Now that we know what causes AML, what are the signs and symptoms to look out for? The signs and symptoms of acute myeloid leukemia can often be vague and are sometimes mistaken for other illnesses. This is largely because the symptoms are caused by a lack of normal blood cells due to the overproduction of abnormal ones. Now let's delve into the most common symptoms of acute myeloid leukemia. Fatigue is one of the primary indicators. This isn't just your run-of-the-mill tiredness, but a profound, persistent exhaustion that doesn't get better with rest. Next, we have fever. People with acute myeloid leukemia often experience recurring or persistent fevers. This is due to their body's weakened ability to fight infections as a result of the disease. Another symptom is frequent infections. The body's immune system is compromised, making it harder to fend off infections. This might manifest as recurrent colds, flu, or other infections that just don't seem to go away. Weight loss is also a common symptom, even without changes in diet or exercise. This is often accompanied by a loss of appetite. Lastly, easy bruising or bleeding is a symptom. This can occur as a result of a decrease in the number of healthy platelets in the blood, leading to bruising at the slightest bump or prolonged bleeding from minor cuts. Despite the severity of these symptoms, acute myeloid leukemia is not a death sentence. There are several treatment options available. Remember, early detection is key, so if you notice any of these signs, consult a healthcare professional immediately. Let's recap what we've learned about acute myeloid leukemia. This condition, also known as AML, is a serious but treatable type of cancer that begins in the bone marrow, where blood cells are made. It swiftly progresses, and if not treated, can prevent the body from producing enough healthy blood cells. Now, what triggers AML? While the exact cause remains unknown, several factors can increase the risk. These include exposure to certain chemicals, radiation, and chemotherapy treatments, as well as certain blood disorders and genetic conditions. However, it's important to note that having one or more of these risk factors does not mean you will definitely develop AML. As for the signs and symptoms, they are often vague and can be mistaken for other, less serious conditions. This is why awareness is key. The symptoms can include fatigue, fever, frequent infections, unexplained weight loss, and easy bruising or bleeding. If you or someone you know experiences these symptoms, it's essential to seek medical advice promptly. Diagnosing AML typically involves blood tests, bone marrow tests, and sometimes genetic testing. These tests not only confirm the diagnosis, but also help doctors determine the best course of treatment. Speaking of treatment, it usually includes chemotherapy, targeted therapy, stem cell transplant, or a combination of these. The choice of treatment depends on several factors, including the patient's age, overall health, and the type of AML. Preventing AML can be challenging due to the lack of specific causes. However, reducing exposure to risk factors where possible, such as avoiding certain chemicals and radiation, can be beneficial. Regular checkups and being aware of the signs and symptoms can also aid in early detection and treatment. Remember, knowledge is power. The more you know about conditions like acute myeloid leukemia, the better equipped you'll be to recognize the signs and seek help if necessary. UMCC, your ultimate medical consultants connectors.